Welcome back to News 12 Now. This morning, we are so glad that you are waking up with us on this Friday morning. Right now, there is a nationwide push for so many in our community and across the nation to get their COVID-19 vaccine. This morning, we are talking with a local doctor, a local infectious disease specialist, a little bit about some of the myths associated with a COVID-19 vaccine and why it's so important for everyone in our community to get vaccinated. And joining us now is Dr. Mark Anderson with CHI Memorial. Good morning, Dr. Anderson.
Good morning.
Thank you for joining us. First of all, Dr.
Yes.
Anderson, tell us a little bit about why it's so important for our community to get vaccinated.
Well, COVID is still out there. The numbers are falling. That's wonderful. Fewer and fewer new cases, fewer people admitted to the hospital for COVID, and fewer deaths. Those are all wonderful things, but they're all still not zero. COVID is still circulating in the United States, and more importantly, it's circulating in a big way outside the United States. And as the last year has proven, with things that happen in distant lands will come here soon, perhaps with variants of the virus, that natural infection doesn't protect you as much as getting the vaccine. So it's going to be with us for a long time. It's not going away. And people are in all likelihood going to get COVID or get vaccinated. That's the choice.
Dr. Anderson, what are some of your patients what have they told you about being hesitant on getting the COVID-19 vaccine? What are some of the myths out there that people are really just afraid of?
So a really common one is that they're fearful because the vaccine came about so quickly. And so I explained to them it was not rushed, no corners were cut. This reflects that we've developed a system in the last 10 years with new tools of science to develop vaccines very quickly, to set up basically a system that is just ready to have a virus's genetic makeup plugged into it, and vaccines can then be manufactured immediately. And that's what happened. Those systems were in place. They're well tested. They've been used in other active vaccines like Ebola vaccines, which have saved thousands of lives. And so we were able to get vaccines quickly and to start giving them in trials over a year ago.
Dr. Anderson, what do you recommend to folks out there who are still on the fence about this? Where can they go find some information to learn more about it?
I think the best place that I recommend is that they talk to their own doctor, either by phone, email, or in person. If they don't have a doctor, they can call the lines for systems in Chattanooga like Memorial's and get a recommendation for a doctor. I think a one-on-one conversation like that, if they're having serious doubts, is better. The CDC and other sites can provide good information. The problem, though, is that there is a lot of misinformation on the internet, and sometimes it can be hard to discern how good that information is. So I think a conversation with a doctor, a nurse, and all doctors are capable of talking about this, whatever their specialty.
Dr. Anderson, is there anyone out there with certain medical conditions that should be concerned about getting the vaccine? And if they are, I know you're suggesting that they talk to their doctor.
Yeah, a few things, especially if they're immune compromised, if they've had a transplant, if they have an immune disease such as lupus or rheumatoid arthritis that they're on strong immune suppressants for, if they're on chemotherapy. That doesn't mean they can't take the vaccine. They probably should take the vaccine, but they should discuss that with a specialist that manages that disease.
Dr. Mark Anderson with CHI Memorial, thank you so much for joining us this morning and giving us this information as the whole nation is being encouraged to get their vaccines.
Yes.
All right. Thanks again so much for joining us and answering some of those questions and some of those myths that so many people have out there in the community. All right. We have much more ahead on News 12 Now this morning. Stay with us. Chip's going to have a check of your Sportsman's forecast coming up right after this.